entering my patient's room, I would look at the order and see what the order says. And today it says full body physical assessment on Jamie Papke. Okay. And I'm going to gather my supplies, which is a stethoscope, pen light, 2x2 gauze, and gloves in case of being in contact with a bodily fluid. Okay. I'm going to perform hand hygiene. Hi, my name is Kylie and I am your student nurse today. Can I have your name and date of birth?
Jamie Papke, 6178.
Jamie Papke, 6178. Jamie Papke, 6178. And do you have any allergies?
No.
Alrighty. Today we're going to be doing a full body physical assessment, which would be an assessment from head to toe. Is that okay?
Okay.
Alrighty. I'm going to provide for privacy. Make sure the bed is locked. Make sure the rails are up. And then I'll bring the bed to working height and put this rail down so you use proper body mechanics. Vital signs were all in optimal range. Are you experiencing any pain right now?
No.
Alright, patient has zero pain. If there was pain, I would have to find the site of pain and assess that there. I'm going to now do the skin assessment part, and I can see that my patient's skin is evenly colored throughout. And now I'm going to palpate and check for moisture, texture, and temperature. And it is not dry, it is warm, and there are no bumps, lesions, or it's smooth. I'm going to now check for skin turgor. Alrighty, skin turgor is good, well hydrated. Then I'm going to get my pen light and check inside of the mouth and check for moisture, color, and lesions. Could you open your mouth for me, please? Okay. No lesions are present. It is moist and pink inside. And could you flip on your side just a little bit for me, please? Alrighty, I'm going to now assess bony prominences to look at skin integrity to see if there is any skin breakdown. There is no skin breakdown on the back of the head, any on the scapula that I'm seeing. There is none on the coccyx or sacrum. I'm going to check the elbows. There is none on the either elbow. And there is no skin breakdown on the heels. So the skin is in shape, no skin breakdown. Could you roll back this way? At this time, I would now note that there are no IVs or drains present. Okay, now I'm going to do the neurological assessment, which will be level of consciousness and alertness. I'm going to ask a few questions. Earlier she stated her name, so that's one question, okay? Could you name who the president is of the United States?
Trump.
And what's the year?
2020.
And where are you at right now?
I'm at home.
Alright, my patient is oriented and alert ×4, okay? Now I'm going to ask you a few questions if you're experiencing any of the following. Headache?
No.
Dizziness?
No.
Blurred vision or double vision?
No.
Ringing of the ears?
No.
Numbness or tingling of the face, arms, or legs?
No.
Alrighty, and now I'm going to check the symmetry of my patient's face. Alright, it is symmetrical. There's no more drooping on one side more than the other. Could you smile? Smile is symmetrical. And could you stick your tongue out? And when they stick the tongue out, tongue is symmetrical also with the face. Okay, now I'm going to check the eyes. Okay. Alrighty. Eyes are round, reactive, and about 3 millimeters in size. They are accommodating. Earlier, my patient's speech was clear, not slurred. It's easy to understand. Now I'm going to check the sclera. Alright, I will check the sclera for any redness, drainage, or lesions. None of that's present. It looks pink. And now I'm going to test the strength and sensation next. Okay, could I have you sit up, please, on the side of the bed? Okay, I'm going to check the arm strength at this time. Could you grab my hands and squeeze? Alright, could you put your hands against mine and push? Alright, and now grab my hands and pull down. Alright, strength is bilaterally equal. Okay, could you lay back down for me? I'm going to now check the strength of the legs and feet. Okay, I'm going to have you pull up towards the sky. Okay, push down. Alright, bilaterally equal. Okay, and then I'm going to take a 2x2 gauze and have my patient close their eyes and let me know where they feel the gauze touching them. Could you close your eyes, please, and just let me know where you feel the gauze?
Right side, left side of face, right arm, right leg, left arm, left leg.
Alrighty, my patient can have full sensation of the face, arms, and legs. Okay, now I have a few questions. Are you experiencing any chest pain?
No.
Alrighty, and then I'm going to palpate each carotid artery separately, one at a time. Okay. Alright, and the carotid artery pulse is strong. It's about a +2 bilaterally. Okay. Now I'm going to locate the 4 valves, and I'm just going to explain where they're at first, and then I'll take a listen. The first valve is the aortic valve, which is right of the sternum, second intercostal space. Then you have the pulmonic valve, which is left of the sternum, second intercostal space. Tricuspid valve is the fourth intercostal space, left of the sternum. And then you have the mitral valve, which is left of the sternum, midclavicular, fifth intercostal space. Typically in this area here, and that's where the apical pulse is taken. And I will be setting my stethoscope on the skin. Okay, take a listen. And I'm just going to go up this way, okay? Take a listen over here. Alrighty. All of those sound good. They're not bounding or skipping a beat or anything. They all sound regular. Now I'm going to ask I would lift the head of the bed to about a 45-degree angle. In this case, I'm going to have her scoot up. Could you just set up to a 45-degree angle? And I would check to see if there is any vein distension, and there is not. None is present. The vein's not sticking out or anything. Okay, can I have you lay back down flat? Sorry about that. I'm going to check capillary refill. Alright. Capillary refill is less than 3 seconds. Now I'm going to check 3 different pulses. I'm going to check the radial pulse, which is here. Bilaterally equal +2. Okay. Now I'm going to check the dorsalis pedis. Bilaterally equal +2. And then I'm going to check the posterior tibial pulse, which is bilaterally equal +2. And then while I'm down here, I will check for edema. No edema is present. Alrighty. And then I have a few questions. Are you experiencing any shortness of breath or coughing or dyspnea?
No.
Alrighty. And if she was experiencing coughing, I would ask what color is the sputum and assess it further. Okay, now I'm going to I'm going to listen to the lungs and everything. I'm going to have you sit up on the side of the bed, please. Okay, I can see just by looking at her with breathing that chest expansion is symmetrical and unlabored. She's not using any accessory muscles to help with breathing. I'm going to take a listen. Each time I lift up my stethoscope from the skin and place it again, could you just take a deep breath through your mouth, please? Okay, I'm going to go up underneath your shirt. Okay, I'm going to go to the back. I'm going to start above the scapula. I want to get on the bed, patient's bed, but for this case. Okay. Pulmonary sounds, lung sounds, they are clear, no wheezing, pleural friction, crackles, anything like that. Are you experiencing any of the following? Nausea or vomiting?
No.
Constipation or diarrhea?
No.
Dysuria, which is urinary, difficult or painful urination?
No.
Alrighty. I'm going to now inspect the abdomen, and I'm going to have you lay back down. Okay. I'm going to take a look at the abdomen, and I can see that the skin is a light pink undertone. Contour is flat and smooth. It's symmetrical, no bumps or anything present by looking. I'm going to now listen to the 4 quadrants. Okay. Stomach sounds are, peristalsis is present. I hear gurgling, growling, it's all moving. Now I'm going to palpate the skin, and I'm going to look for nonverbals and also verbals of any pain or tenderness. Okay, just let me know if any spot is painful or tender, okay? Okay, no discomfort or pain or tenderness present in the abdomen. Now I will palpate the bladder to look for bladder distension, discomfort, or rigidity feeling. Okay, I'm going to palpate your bladder now. Any pain?
No.
No? Alrighty. Bladder is not distended or any discomfort was present, none at all. And now put this down. Okay. And then now I'm going to position my patient to be comfortable. I would lower the bed, make sure side rails are up. I would give my patient a call light. Do you need anything else?
No.
No? Alrighty. I would wash my hands, and then I would leave the room and document my findings on the full body physical assessment.